In the midst of all of the bad things about the Affordable Care Act, we do have some more data that the good things about Obamacare are actually working. Jason Millman has been listening in on earnings calls for publicly traded hospital chains, and he says that they all are reporting a big difference in admissions in states that have expanded Medicaid and states that have refused to expand Medicaid. Of course, Medicaid expansion, part of the Affordable Care Act. Listen to this. The Hospital Corporation of America saw 22% growth in Medicaid admissions compared to a 1.3% decline in non-expansion states. The company also had a 29% decline in uninsured admissions in states that have expanded Medicaid, while non-expansion states experienced 6% growth in uninsured admissions, according to Chief Financial Officer William Rutherford. Now, remember, Lewis, one of the biggest problems we have with the status quo, employer-connected, for-profit healthcare system in this country is that when people don't have health insurance, they're uninsured, they go to the emergency room, and we know that the cost, or let me say it a different way, the amount ultimately collected by hospitals from uninsured patients who go into the emergency room is less than the cost of the Medicaid reimbursements for patients going in, for equivalent patients going in. In other words, you will actually still collect more money as a hospital billing the decreased Medicaid rates than you will billing the full rates for uninsured people. But of course, as we know, ultimately not collecting all of that money. However, we still see Republicans, even though it is fiscally conservative to expand Medicaid, refusing to do it. Maybe it's because they don't like the idea of the government giving anybody anything. Maybe it's because they don't like the idea of going along with anything President Obama has proposed, but it is factually speaking not fiscally conservative.
Of the two things you mentioned, it was probably the latter. But yeah, I mean, I guess I wish we could, in some ways, let doctors and hospitals decide what the best course of action is. I think
the interesting thing about that, yeah, we do know, right? The hospitals support the Medicaid expansion. And Lewis, a lot of these hospital companies, Community Health Systems, Tenet Healthcare, Hospital Corporation of America, they are all based in red states that have not expanded Medicaid, but they understand that the blue state Medicaid expansion policies are the best for them.
Right. It's just political games our guys in Congress are playing, and it's affecting people's lives, affecting them, their health, you know.
The Affordable Care Act is pro-business. I don't understand why Republicans are opposed to it. I guess it's because President Obama put it forward. If President Obama came out and said, I am against Medicaid expansion all across the country, that would probably be the most effective thing in getting these Republican governors to enact it.
Yeah, reverse psychology. Or maybe he should have just named it Reagan Care.
Reagan Care. I love it, Lewis. That actually, we would probably see widespread Medicaid expansion if it was called Reagan Care. This program is supported directly by you. Please go to davidpakman.com/membership to become a supporter today and get a whole bunch of great member benefits while doing it.